Hello everyone, and welcome back to the part 2 of the skull series. I would request you to please watch part 1 before watching this video, and the link to the video is in the description below. So starting on with the posterior view of the skull, or NORMA occipitalis, the bones that we can identify from this view are the posterior parts of the parietal bone above. Below them we can see the upper part of the squamous part of the occipital bone, and on each side right here, these are the mastoid part of the temporal bone. As you can see, this one right here, this is the mastoid part of the temporal bone. Similarly here, just to make it clear, although I will discuss this in the lateral view of the skull, but this is the temporal bone, this one, and this is the squamous part of the temporal bone, whereas this is the mastoid part of the temporal bone. So from the posterior view, this is the mastoid part of the temporal bone. Similarly here, so on each side we can see the mastoid part of the temporal bone. Moving on to the sutures. First of all, we can identify the Lambdoid Suture. This is the Lambdoid Suture, and it separates the occipital bone from the parietal bones. The next suture that we can identify is the Occipitomastoid Suture. As the name suggests, it is occipitomastoid. That is the occipital bone, this one, and the mastoid part of the temporal bone. So the occipital bone is being separated from the mastoid part of the temporal bone through this suture. Just to make this clear, this is the suture. This was the Lambdoid Suture right here, and it got bifurcated. This part, or this suture, is the Occipitomastoid Suture, as this separates the mastoid part of the temporal bone from the occipital bone. The next suture that we can see is the Parieto-mastoid Suture. Again, as the name suggests, Parieto-mastoid. This was the parietal bone, this is the parietal bone, and this is the mastoid part of the temporal bone. So the suture is this one. I'll show you from laterally as well. You see, this is the Parieto-mastoid Suture. It is separating the mastoid part of the temporal bone through the parietal bone. Similarly on this side, this is the Parieto-mastoid Suture. It is separating the parietal bone from the mastoid part of the temporal bone. We can also identify the posterior part of the Sagittal Suture. This is the posterior part of the Sagittal Suture that can be seen from NORMA Occipitalis. Some other features that we can identify are the Lambda. This is the Lambda, and this is the meeting point of the Lambdoid Suture with the Sagittal Suture. This is Lambda. The Parietal Foramena, this is the Parietal Foramena, and this has been described in the previous part, that is part 1. The link for part 1 is in the description below. Also we can identify oblique. This is oblique, the point between the Parietal Foramena. This is oblique. Now moving on, in the posterior view, this protuberance, this is the protuberance, and it is known as the external occipital protuberance. This is a median prominence in the lower part of this view, and it marks the junction of the head and the neck. So this is the external occipital protuberance. You can also identify the external occipital protuberance at the back of your head. It will be the most hardest part that you can feel by your fingers in the posterior of your head. So this is the external occipital prominence or external occipital protuberance. It marks the junction of the head and the neck. The most prominent point on this protuberance is known as the anion or anion, as you would like to call it. So the most prominent part of the external occipital protuberance right here, this is the anion or anion. Now laterally to the external occipital protuberance, you can see these lines. These are the lines that are being originated laterally from the external occipital protuberance, and these are called as the superior nuchal lines. These are curved bony ridges passing laterally from the protuberance, and they also mark the junction of the head and the neck. The area below the superior nuchal lines will be described in the inferior view of the skull, that is the NORMA basalis or NORMA basilis. The next feature that we can identify are the highest nuchal lines. The highest nuchal lines are present 1 centimeter above the superior nuchal lines, and they are not always present on the skull. The next point is the occipital point. The occipital point, it lies just above the anion, as this was the anion. Just above the anion is the occipital point, and this occipital point is the farthest point from the glabella. Glabella I will describe in the anterior view of the skull. There is a foramen that can be identified on the posterior view, and it is known as the mastoid foramen. The mastoid foramen, to identify this foramen, you need to move towards the occipitomastoid suture. This is the occipitomastoid suture, and just laterally this is the mastoid foramen. Similarly, on this side, this is the occipitomastoid suture, and right laterally to the suture is this foramen. This is the mastoid foramen. Right here, this one, and right here, this one. This is the mastoid foramen. The mastoid foramen, it transmits an emissary vein and the meningeal branch of the occipital artery. Once again, it transmits an emissary vein and the meningeal branch of the occipital artery. The next feature is the interparietal bone. This bone is occasionally present, and it is a large triangular bone that is located at the apex of the squamous occipital. It is not a sutural bone, but it represents the membranous part of the occipital bone that fails to fuse. Now moving on to the attachments. The upper part of the external occipital protuberance, it acts as the origin, or it gives origin to the trapezius muscle. The lower part, it gives attachment to the upper end of the Ligamentum Nuchae. The medial 1/3 of the superior nuchal lines, these were the superior nuchal lines. So the medial part, it also gives origin to the trapezius muscle, and the lateral part, it provides origin or insertion. It provides insertion to the Sternocleidomastoid muscle above and the Spenius Capitis muscle below. The highest nuchal lines, if they are present, they provide attachment to the Epicranial Aponeurosis medially, and they give origin to the Occipitalis or the occipital belly of Occipito frontalis muscle. In case the highest nuchal lines are absent, these features or these structures are attached to the superior nuchal lines. This was all about the posterior view of the skull. Do give the video a thumbs up if this helped you, and if you are new to the channel, do hit the subscribe button.